The risk associated with immediate loading implants is negligible if you follow a right doctor. Well, there is a lot of clinical and scientific records for immediate loading implants. Many doctors are already working and doing research on this implantology because it is the streaming and it's the upcoming branch in dental implantology. Even myself, I am into the clinical research with respect to immediate loading, and we are regularly doing the research and making the stream as beautiful as possible to serve our patient in limited period of time with the best possible results. The risk associated with immediate loading implants is negligible if you follow a right doctor, if you follow their instructions correctly, if you chew from both sides, avoid chewing from one side, and definitely if you do a good follow-up to the doctor, the problem will be minimum. And if suppose in case any problem is there, you should immediately notify your doctor and get the treatment done immediately. All the situations are treatable. These implants are the replica of the regular implants. The size is more than 10 times the size of the regular implants, so don't get confused. Let's start with the delayed loading conventional two-piece implant. The two-piece implant is that implant which has a implant body which is placed in the patient's bone. Then after a period of 2 months to 6 months, the gums are cut open, and after that the abutment, this is called abutment part of the implant, this is connected onto the implant body like this, and now this can come out inside. This is connected to implant body by means of certain screws and the screwdrivers. So screwdrivers is used to connect the implant abutment to the implant body. Once this goes inside, it becomes one single piece. But if you know, see, this abutment is connected to implant by means of certain screw. So if there is any overloading on implant, this screw can get loosened something like this. This can loosen off like this. And if this loosen off, because of the chewing force, this small inner screw can get simply fractured. Second thing is, there is always some micro gaps can be there in between this part of the implant, that is abutment, and the implant body. So these micro gaps can be, if you see this is far more enough for a bacteria to colonize. So chances of peri-implantitis is high with such kind of design. If you compare the same thing in patients single piece implants, this is the abutment, this is the implant body. They are the single piece, they are the mono piece. There is no connection between the abutment and the implant body, so there is no screw. So there is no question of screw loosening, there is no question of screw fracture, and of course no question of bacteria getting colonized on this. Variable single piece implants has been available with immediate loading implant systems such as BCS, such as KOS Plus, such as KOS Micro, and TPG implants are also available. Now the best advantage is that the BCS implants is highly polished all around. The KOS implant is polished on the abutment side, but on the implant side they are surface treated. Whereas here all the implants are surface treated, so the chances of bacteria getting harbor on this surface treated, that is rough surface implant, is far more. But on the BCS it will be far minimum. You can see the BCS implant here. This is the BCS implant. Okay, so this is the basic advantage of the single piece implants over the two piece implants. Two piece implants can be used when there is a severe changes in angle is required. In two piece implants they use something called angle abutment, and they can change angle something like this. They can change angle something like this with the angle abutment, something like this they can put. But when single piece is to be used, it is difficult to change angle, but with BCS it is still possible to change the angle. Because of the design of the BCS, it is possible to bend the implants. So that is the reason even the problem of angulations can be overcome with the single piece implants. And these implants are engaged into the cortical bone, whereas this implants stays into the cancellous bone. That is another advantage. The procedure with two piece implants, the impression procedure, lab procedure, and the other part, maintenance part with two piece implants, is quite difficult compared to that with that of single piece implants. So advantage of single piece implants is quite more compared to the two piece implants. Thank you so much.